3B, Ryan.
3B.
3B. The PIH, yes. We are now recording. Okay, we have made quorum, Ryan.
Okay, wonderful. Thank you, Sarah. And good afternoon, everybody, and welcome to Monday and this edition of the Continuum of Care Board meeting. I'll now have Sarah commence with roll call of each board member's name and ask you to introduce yourself and your organization.
Great. Co-chair Ryan Balch.
Oh, hi, I'm Ryan Balch from the city of Chandler. Welcome, everyone.
Eric Cole.
Hi, it's Eric Cole from ASU, and I'm back in the office. Woohoo!
All right. Marshall Franklin.
So good afternoon, everyone. Marshall Franklin, City of Phoenix Human Services Department. And when I can figure out how to make the camera work, I will turn my video on. Right now, it's not working, so.
Tad Gary. Okay. Samantha Jackson. Okay. Bruce Liggett.
Afternoon, Bruce Liggett, Maricopa County Human Services.
Hi, Bruce. Joan Service. Charles Sullivan.
Hi, Charles Sullivan with ABC Housing.
Great. Hi, Charles. Jackie Taylor.
Hi, Jackie Taylor, Save the Family.
Hi, Jackie. Co-chair Tamara Wright.
Hi, Tamara Wright, Community Solutions.
And then we'll go back up. Tad Gary.
Hi, Tad Gary with Mercy Care. Thank you.
Great. I think that's all we've got for now.
Okay.
Hand it
Did we
over
miss
to you.
anyone, just in case?
Yes, Liz DaCosta with Community Bridges.
Thank you, Liz. Appreciate it.
Thanks, Liz. So I have a quick announcement, everyone. I'm saddened to tell you that our esteemed colleague Tamara Wright will be leaving her position with Community Solutions and embarking on new adventures. So her last day on this board will be June 1st. I want to take a moment to thank Tamara for her leadership and her service as a member of our board for over 5 years, and her continued work and dedication around racial equity and ending veteran homelessness. Tamara, I know I'm going to miss you like crazy, but I hope we will have the opportunity to work with you very soon when you tell us more about your new adventures. So I would like to take a moment. Does anyone want to make any comments to Tamara?
I'll start.
Sorry. No, please go ahead.
Yeah, my goodness, Tamara, it's been such a pleasure working beside you in so many different committee meetings. And then on this board, you have been at the forefront of some of the most challenging conversations, just always speaking to the benefit of the members and the people that we serve. It's just been, just like I said, just such a benefit to be able to work beside you. So thank you so much.
Thank you.
Tamara, this is Jackie. I would echo that. You've just been an amazing leader on this board, and you've got a good sidekick here to help carry it forward. We will miss you, but we look forward to learning more about what's happening in this next chapter for you. So best of wishes and much happiness in your next endeavor.
Thank you so much, Jackie.
And Tamara, this is Tad. I think we joined roughly around the same time, and seeing you and your involvement and just your work across the community has been pretty incredible to see your leadership at hand, and seeing your name attached to so many things is always kind of part of the what I gauge as how involved people are, and your name definitely has come up so much, always in positive ways. And really speaks volume to your impact here in the community. So really appreciate all your work, and really sad to see you go, but hopefully it's on to better things for you, your family, and the community.
Thank you so much, Tad.
Yeah, hey, it's Eric. I just want to echo what everybody else has said. Personally, Tamara, you were a friend to me when I got started and helped me adjust and understand things here locally, and just really, really appreciate that. I'm very excited for you, and I'm sad to hear that you're not going to be with us anymore, but know wherever you are, you're going to do amazing things and also be a kind and good-hearted person. So it's been great to work with you.
Thank you so much, Eric. You too. All of you, really. Thank you so much.
I just want to echo what everybody has said. You know, your amazing work within the racial equity realm, your work for veterans and ending homelessness. The first time I met you, Tamara, I'll never forget your water bottle that is like bright pink, sparkly, and says not vodka. That's just your awesome, well-rounded personality. And we will definitely miss you and hope that your next position brings you near us again.
Thank you so much.
And I also want to echo about the racial equity piece. You have been such a huge cheerleader in our community to make sure this happens and that we're looking at things through an equity lens. And I personally appreciate that, personally and professionally. So thank you for being a champion in our community, and please continue to see ways that we can support you in your new endeavors as well.
Thanks, Nikki.
Well, Tamara, I hope you can feel the love in the room and how much we're all going to miss you. And I hope you hurry back to us very quickly once you land. We will try to keep your seat warm.
Okay, great. I will definitely.
Don't take too long. All right. Before we begin, I'll just review a couple of housekeeping items. For all participants, if you could please mute your phone when you're not speaking, and please do not put your phone on hold, lest we all get a lesson in, what do you call that? Elevator music. Also, for all participants, we ask that you please identify yourself when speaking. We will be reminding people of that throughout the meeting. MAG operates committee meetings and the COC board meeting in full transparency, giving the public access to committee meetings, materials, and discussion. The public cannot view the chat comments. As a result, we are disabling the chat feature in all board meetings moving forward. If you need technical assistance during a meeting, please contact the helpline or contact MAG staff, Sarah Kent, who is assigned to the meeting. We appreciate your understanding and helping to maintain transparent discussions for the benefit of the public. Finally, all votes will be roll call votes. Sarah will call the roll after the motion is made. So on to call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within an hour of the posted time for the meeting. Sarah, were there any comments received?
No, Ryan, I have not received any today.
Okay.
Or at all.
All right, thank you. So with that, we will move on to the next agenda item, which is approval of the consent agenda. Before we begin, our consent agenda items today are 3A through 3C, but I'd like to call on our newest staff person, Nikki Stevens, to give us a quick briefing on 3B.
Okay, as you guys have seen in your packet, the Emergency Housing Voucher Program is available through the American Rescue Plan Act, ARPA, they're calling it. Through the Emergency Housing Vouchers, HUD is providing 70,000 housing choice vouchers to local public housing authorities in order to assist individuals and families who are homeless, at risk of homelessness, fleeing or attempting to flee domestic violence, or were recently homeless or at high risk of housing instability. The following PHAs have received vouchers. Scottsdale received 34, Tempe 50, Chandler 28, Maricopa County 89, Phoenix 390, Mesa 108, Glendale 72. And on May 19th, MAG did hold a listening session that allowed both our Corporation for Supportive Housing, technical assistance providers, and our PHAs, along with coordinated entry leads, to be able to go through, just kind of ask questions. This came rather quickly. Today is the deadline for all PHAs to accept the housing vouchers. So this is great news for our community. We'll have over almost 800 plus, because I know some other PHAs have accepted more than they're allocated. So this is exciting to have additional housing vouchers coming into our community. Thank you.
Thanks, Nikki. I appreciate that. As a reminder, please note that board members may request that an item be removed from the consent agenda if there is a need for discussion. Board members cannot comment on a consent agenda item without first removing it for discussion. Does any board member request a discussion of any of these items? All right, hearing none, do I have a motion to approve the consent agenda items? Please state your name.
This is Chad. I'm so moved.
This Eric, I'll
Chad.
second.
Was that Eric?
Yeah, Eric, I'll second.
Thanks, Eric. Okay, we have a motion from Tad and a second from Eric. Now I will hand it over to Sarah, who will proceed with the roll call. Please indicate clearly how you choose to motion, stating a yay or nay after your name is called. Sarah?
Great, thank you. Co-Chair Ryan Balch,
Yay.
Eric Cole. Eric, you're on mute.
Yay, sorry about that.
No problem. Elizabeth DaCosta.
Aye.
Thank you. Marshall Franklin.
Yay.
Thank you. Tad Gary.
Yay.
Thank you. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Aye.
Thank you. Joan Service. She will be joining us shortly. Charles Sullivan.
Aye.
Thank you. Jackie Taylor.
Aye.
Co-Chair Tamara Wright.
Aye.
Thank you. The motion passes.
All right, thanks, everyone. Now we'll move on to a couple items to be heard. So our first item is actually it's an action item on the Regional Homeless Strategies portfolio. Amy St. Peter, Deputy Executive Director at MAB, will present on the Regional Homeless Strategies portfolio recommended for board action. Amy?
Thank you very much, Madam Chair and members of the board. Really appreciate your partnership as we have been hard at work to pull together these strategies since the fall. Jeremy, if you could please start showing the presentation, that would be great. Thank you. So the purpose of my presentation today is to be able to offer these strategies to you. The action today is a recommendation to accept the portfolio and to adopt the 14 strategies while adding some additional detail, particularly around the funding that will be needed to implement these strategies. So I think it's helpful to view these strategies in as a starting point for how we will move forward together as a region. These have been shared with you since March, and we appreciate all of your feedback that have really helped to significantly shape these and to be able to identify the most viable actions that the region can take moving forward. So we look forward to your additional feedback, to the innovation, to the additional ideas for how we can further refine these and put these into action as we develop the implementation plan in a collaborative way and partners identify how they want to be involved in these regional efforts. Next slide, please. So just want to take a moment to ground all of this work in these areas of focus. So through all of these activities, through all the 14 strategies, we're keenly focused particularly on these three things. One is to reduce the numbers of people experiencing homelessness. This isn't a plan to plan, it's a plan to do something, and the strategies really will help us to direct our activity. We also are very keenly focused on the geographic footprint of these homeless assistance programs, understanding that right now they're clustered within a few communities, but there's need present in every single community to some degree, and so the assistance needs to be there as well. That third element then has two different components to it. One, in terms of strengthening that safety net, that's really speaking to the importance of prevention. We want to make sure that as people are kind of entering a personal crisis in their own lives, as a system, as a community, we can support them to remain in their homes and not have to become homeless in the first place. And also including the fact that this focuses on all people with a racial equity lens. The board has really pioneered work in this space. We are embedding all of that within these strategies moving forward. These strategies were just voted for recommendation to accept the portfolio and to adopt the strategies. The MAG Management Committee just took that vote on May 12th. We offer that same action to you today. And then on Wednesday of this week, then that final action will go to Regional Council for their consideration as well. Next slide, please. It has taken many, many people working together, a lot of expertise from very talented partners to come to this point today. We count you as the leaders in that space. And so we're thankful for your support. We thank you for your partnership. We've been very, very grateful to all of these partners and more who have really worked together to make this happen. There are others who are eager not just to help the development of the strategies, but also to help with funding the implementation. So different partners like the United Way, like Access. There are so many people who have funding and they're ready. They're ready, they stand with you, and they really are looking forward to being able to partner with you in this space. So it helps us to know what your priorities are as this work moves forward, so we can make sure that all of these regional efforts leverage your deep expertise in this space and that we're able to move forward in alignment with you. Next slide, please. These are the topics that I'll be covering today. Please don't hesitate though to reach out, step in with your questions, your ideas, if there are other topics that you'd like to address in addition to these. Next slide, please. The context in which this work is taking place is critically important. And as we define that context, we're using data. We're using data to understand the context as well as to drive the decisions. And so these are the topics that we'll be touching on in terms of that data. Next slide, please. Now, you know probably better than anybody how much we're facing a crisis in our community right now in terms of the increasing numbers of people who are experiencing homelessness. Not only are they have they been increasing in our region for the past 4 years, that's a common trend that you'll see throughout the country, but we're particularly concerned about those how our growth is outpacing the growth that we see anywhere else in the country. When you look to the highest percentage increases in homelessness, that's right here in the state of Arizona. That holds true both for general for homelessness in general, as well as homelessness among single individuals at just under 10%. We have the 5th highest percentage increase in the entire country for families who are experiencing homelessness, and we're very intent on working together to reverse these concerning trends. Next slide, please. Again, you know this is your expertise, but when we talk to people who are experiencing homelessness right now, this is what they're telling us. It's family disputes, economic reasons, and evictions are the top 3 reasons. Also included there, you'll see mental health as well as substance use issues, according to data that we have in HMIS right now. Next slide, please. We're not just focused though on people who are experiencing homelessness right now, we're also focused on the people who are at risk of experiencing homelessness in probably the near future. And so one way that we're coming to better understand that population is in looking at calls to 211 for housing and homeless assistance services. So from May to December of last year, this is the locations of the people who have called in for assistance. You'll see that every community throughout the region has some level of need. Next slide, please. That need becomes even more pronounced when we consider the households who are vulnerable to becoming homeless in the future. A common measure for that is the households who are spending more than 30% of their monthly income just on housing alone. And so you'll see even in affluent communities, there are households who are at risk, who are vulnerable to experiencing homelessness. And so as we're talking to communities, even when or if communities don't necessarily have a high count according to the point in time count, they do absolutely have people who are at risk for becoming homeless. And we want to make sure that they receive the prevention services that they need in order not to lose their homes. Next slide, please. It's also critically important, going back to that second area of focus earlier in the presentation, to take a look at where the homeless assistance programs are. So this is a map of the shelter and housing units and where they are in terms of their scale as well as their location. You'll notice that the locations are present in a number of communities throughout the region, but not all. And we know that people stabilize more quickly when they're close to home, when they're in their home community, because that's when they're close to their job, to their children's school, to medical care, to places of worship, to family. And so we want to make sure that people can access help no matter where they live in the valley. Next slide, please. Just as a reminder then, we started ramping up these regional efforts last fall. And that began with research and outreach because we want to make sure that the perspectives of the community and the data are really driving these choices that we have as a region. We are right in the middle of that blue circle right now with the regional strategies as they move forward for action. And the next month then we'll start pivoting to implementation with our capstone event. Next slide, please. So then in summary, these are the efforts that have led us here to today. Extensive outreach and research, in particular looking at ongoing tools that you can use to further your planning, such as Hand Up, which is our homelessness assets and needs data for unified planning mapping tool, as well as the development, not just of the strategies, but of the elements around that, such as the values, the vision, and then to come the tactics. Next slide, please. I'd like to focus just for a moment on what is included in the proposed action today, as well as what is not included. Next slide, please. So this is the action that we're looking at today. It's actually to recommend acceptance of the portfolio and adoption of those 14 strategies. Just about everything in that portfolio has been previously vetted. You've seen it, you've contributed to it, and we thank you for that feedback and helping to shape all of these different elements. Next slide, please. This is what is not included. There's a fair amount of work underway, which you'll be hearing about in just a moment, in terms of projecting the number of additional shelter beds, housing units, and diversion services that are needed right now in our region. On the basis of that, as well as a cost analysis, we'll be developing regional funding targets, as well as the scenarios. And then, of course, the implementation plan will have a lot of the detail that we're all really wanting and needing in terms of more clarity around the funding, as well as the roles and partnerships. The timeline for that remaining work then is that we will pivot to implementation next month. We anticipate having the implementation plan for probably just for information in August. We want to make sure that we give ample time for folks to be able to review that plan, make sure that this reflects their commitments to move forward together as a region in a coordinated fashion, and then to be able to offer that then for action probably early fall, then September timeframe. Next slide, please. So these are the regional strategies that you have helped to develop. We thank you for all of your assistance with that. Next slide, please. And these are the strategies into which these, the categories into which these categories are organized. All of these represent the region's most viable opportunities to act together as a region in a collaborative way, to be able to leverage each other and to be able to support each other. Next slide, please. These are the strategies then that have been developed. All of these will require a multi-sector approach, not just to implementation, but absolutely to funding. So taking a look at private sources, public sources, braiding different funding sources to make sure that that support is available, that the programs are financially stable and sustainable for the long term. You'll notice that all of the 4 items for your racial equity plan are embedded directly into this. 3 of them are located in the coordination category alone. And so we're wanting to make sure that all of these strategies have that racial equity lens, and that we're moving forward to serve all people together in a way that, that does not discriminate and that does not prohibit anyone or necessarily impede anyone from being able to stabilize. It is important to keep in mind that the expectation is not necessarily that every community will implement all of these strategies. Some communities will lean more into others, and also keeping in mind that our community partners are absolutely moving this work forward. Just as we look to you as a board to move the work forward in terms of racial equity as a leader in that space with support from many in the community, other partners are helping to move forward the other strategies as well, such as the landlord engagement strategy. So it's important to keep all of that in mind, that it will take a lot of different people, a lot of different sectors working together to make these strategies viable and to be able to implement them fully throughout the entire region through that really coordinated regional approach. Next slide, please. These are the next steps then. We are looking for action on the portfolio this month, being able to pivot then next month to the capstone event. The registration has just opened up for that. We'll make sure that today you receive that invitation and that you have an opportunity to register for that. In just a few moments, you'll be hearing a little bit more about the regional funding targets and the scenarios. There are some key policy questions that really need to be addressed as we develop the methodology for that work. So we'll be talking with you a bit about that methodology, and then to be able to get your guidance on how to implement that methodology in a really relevant and responsive way. And then, of course, being able to deliver the implementation plan, working really closely with you over the summer months, being able to identify the specific tactics and outcome measures, as well as the possible funding sources that can be used to move this work forward. Next slide, please. That does conclude my formal presentation, but not the end of this dialogue. I do hope to hear your questions, your ideas, and then be able to work with you then as we move to finalize these strategies and then pivot to implementation. Thank you very much, Madam Chair and the board. I turn the podium, I guess, virtual podium back to you.
Thank you so much, Amy. I know there's been so much work done putting these strategies together and vetting them in the community and getting input and getting us to this point. So I can't thank you and your team enough for landing us here today. Before we move on, I'd like to know if any of the board members have any questions.
Yeah, this is Tad, and echo what Ryan said. This looks really great, and Amy and team, thanks for all your work on this. Definitely, I know it's been a long time coming. My question really relates to the strategies, that the high-level strategies you have laid out. I'm sure it's nestled within one of those categories, but housing navigation as a service, where does that fit within that? Because I know from my vantage point, I'm pretty sensitive to the need for that, and would just be interested in kind of feeling comfortable and knowing where that lands.
Thank you very much, Madam Chair, members of the board, and Mr. Gary. Absolutely, we fully agree. Housing navigation is a critical element. We do see that as part of, as a critical element within the pathways to housing that would be developed under the housing category. And so as we're looking at housing, and you'll hear a bit more about this in terms of the scenarios, we're not just looking at the kinds of interventions that are needed, but the flow. And the flow is really, really critical to that, to make sure that we're not creating perhaps inadvertently any bottlenecks and that we're not leaving any gaps. The housing navigation is also important to help people be able to access the services that are currently available. And sometimes if people don't know, or if they don't understand how they might fit into these different programs, or programs don't understand how they can adapt to the needs of the people who are looking for shelter and housing, then housing navigation can really help with those conversations. So primarily I see that as part of the housing category, as well as the services category in terms of that cross-sector coordination.
Thank you.
And this might be a good time to mention, Amy and board, that there's a very comprehensive document lending much more detail to this, higher level presentation. And I believe it can be found on MAG's website if anybody is interested in taking a look at it.
Yes, thank you so much, Madam Chair and the board. The full strategy report is available to you on the MAG website, as well as the executive summary, in case you're looking for a more concise version of those strategies.
Other board members? All right.
Ryan, you're muted right now.
Thanks. Did you hear me call for other board members? Yes, you got that piece. Okay. Seeing none, do I have a motion to approve the regional portfolio and adopt the 14 strategies? Please state your name.
This is Marshall. I'll move to approve.
Thank you, Marshall. Do we have a second?
Samantha, I'll second.
Thanks so much, Samantha. So we have a motion from Marshall and a second from Samantha. Now I'll ask Sarah to proceed with the roll call. Please indicate clearly how you are voting by a yay or a nay. Sarah?
Thank you, Ryan. First, co-chair Ryan Balch.
Yay.
Thank you. Eric Cole. Eric Cole.
I'm an aye.
Great. Thank you, Eric. Elizabeth DaCosta.
Aye. Thanks.
Aye.
Thank you, Eric.
Thank
you, Elizabeth. Marshall Franklin.
Aye.
Thank you. Tad Gary.
Aye.
Thank you. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Aye.
Thank you. Joan Service. Charles Sullivan.
Aye.
Thank you. Jackie Taylor.
Aye.
Thank you. Co-chair Tamara Wright.
Aye.
Thank you. The motion passes.
All right. Thank you, Sarah, and thank you, board members. Again, staff, great job. This was a tremendous amount of work, and I really feel like this is a moment of movement. Now we have strategies, and we can move forward on actually developing an implementation plan. So I hope everybody has your bootstraps on, and we can get forward to action planning. So we'll move on to number 5. Sapna Gupta, Policy Planner at MAG, and Sarah Murley, Principal with Applied Economics, Ty Rosenstale, Director of HMIS and Data Resources, and Amy St. Peter, Deputy Executive Director of MAG, will present on the scenarios for projecting the costs of regional homelessness strategies.
Thank you, Madam Co-Chair and members of the board for the opportunity to present today on the work we're undertaking for the cost analysis and for the development of regional scenarios. This cost and scenario development is part of the regional response that Amy just presented and that the board just voted on. But it's a further continuation of it. That's what I meant to say. Yes, we all know that the numbers have gone up on a historical basis, and with the impact of the pandemic on the economy, it is important to be prepared for a range of impacts. The cost analysis and the regional scenarios are in preparation for this impact that we might be feeling, as well as to address the numbers of persons experiencing homelessness that has been growing. Our work has been informed by the feedback and input we have received from stakeholders, from technical assistance provider, the Corporation for Supportive Housing, Meadow Robinson and Julie Silas at Homebase, Sarah Murley of Applied Economics, and you'll be hearing from Sarah a little bit further on, as well as the data underlying the analysis that Ty will be presenting. I will discuss the scenarios further, but first, and Ty will also discuss the data on the persons that are being assisted for the system. Next slide, please. So we're developing, as you can see on this slide, we're developing 4 high-level scenarios to project the amount of and the type of housing needed and to estimate the ensuing cost. So scenario 0 is the status quo without additional intervention or investments, just so that we understand what the baseline is. Scenario 1 is to reduce unsheltered homelessness. And scenario 2 is to reduce chronic homelessness for persons with substance use and mental health issues. And scenario 3 is to reduce family homelessness. We will be scheduling another meeting to vet the scenarios, the costs, and the analysis further. And we're looking for volunteers from the board to meet with us and do a deeper dive to review the analysis over the next 2 weeks. The review, we'll also be doing a review with municipal human services directors. So this meeting to do a deeper dive with volunteers from the board can happen with the human services director, or if you prefer, it can happen separately. Please let us know what preference would be. Our MAG colleague, Linda Priano, is working on a date now. Now, so you see that there are 3 scenarios plus the scenario 0 that's listed. And I wanted to mention that we're also working on numbers to include a possible surge scenario. So persons who might experience evictions once the moratorium is fully lifted. And I will address that in a later slide. What I like to do first, though, is to pass the mic on to Ty to discuss the data on the persons and households who are receiving assistance and who are in the HMIS system. These numbers that Ty will be discussing underlie the model that we're working on and the scenarios. Ty, the mic is now yours.
Thanks a lot, Sapna. If we can go to the next slide, I'll introduce myself. My name is Ty Rosensteel. I'm the Director of HMIS and Database Resources at Solari Crisis and Human Services, formerly Crisis Response Network. The piece that I'm going to share today is really the methodology around how we are building out these scenarios, and that we're looking to use a data set that is a little bit different than what we have used for planning purposes in the past. So if you are not familiar with the process, Community Solutions a national technical assistance and advocacy firm, has really promoted the idea of using a by name list for managing your coordinated entry data and for being able to say how many people in your system are actively homelessness on a per person or by name basis. And our community has implemented this in a really interesting and I would say very positive way. Our by name list is generated from the Homeless Management Information System, includes all programs and program types. It includes sheltered persons and unsheltered persons. And it allows you to be able to track a person through the system, where you're able to say when was their first day experiencing homelessness, where did they come from, what programs are they actively being served by, where did they move to out of the system. And there's two really interesting pieces to this. The first is that the data is generated on a weekly basis and distributed to our coordinated entry points for coordination purposes, housing referrals and housing match purposes. Because it's actually used and it's used by providers, we get instant feedback on if the data quality is good or not. So if we have swaths of people that are missing from the by name list, we're able to hear that there are people that are missing from the by name list. If there are people that are staying on the by name list longer than they should, we're able to address all of those issues and make sure that the data is really good. The other piece is that we generate the data on a monthly basis for data analysis and planning. And that's what I wanted to discuss with the board today, was that we're looking at utilizing these, this by name list process and the data that we get on a monthly basis to be able to inform the regional strategies. So I'm going to go through each of these three components that are on the screen and just say how we're utilizing these in our regional planning process. So the first is actively homeless. This is right in the middle. These are the total number of persons that are experiencing homelessness, and we're able to do this by subpopulation. So we can say how many total people, how many families, how many singles, how many chronic, how many youth, veterans, unsheltered persons, older persons, etc. We're able to track this over time on a monthly basis, which allows us to say, is a population increasing, decreasing, or staying the same over time? So we have our point in time metrics that give us indication on an annual basis. This would allow us to give a much more granular view to see those same increases and decreases. And because we're looking at a monthly basis, we're able to see very specific ways that the scenarios need to address homelessness. The next section that we point to is the inflow. So this is the left-hand side of the infographic. The inflow metrics will tell us where people are coming from when they enter homelessness, where they're coming from, either being brand new and never utilizing services before, having utilized a housing subsidy previously, or returning to the system from an inactive status. So basically churning in and out of the system over time. By looking specifically at the inflow, it will allow us to make projections on how homelessness may be impacted in the future by a surge of new people entering the system. So if we say, the economic fallout of the pandemic is going to result in new people entering the system, you wouldn't just multiply actively homeless. You'd actually look at the inflow and say, historically, the new people that are entering the system has been this rate. If we think the pandemic will make it worse, it will increase that inflow by a certain amount. We'd be changing that particular lever. Then the last piece is on the outflow side. The outflow side allows us to look where people are flowing to within the by name list and also where they're moving to, being able to track housing placements as well as unknown exits. We can track housing placements over time to see how interventions are working or not working and how those interventions are impacting the system. And so the other piece is that we can also see how populations are being served within the homeless system and where they're moving to. So for instance, we're able to look at differences in how families are able to access the system versus single persons in the system. We're able to look by subpopulation for unsheltered. And so we can say, what percentage of people that are unsheltered are able to be offered or move into a shelter or housing option. And we can find, really interesting differences that exist between the systems. So, one thing that we can talk about is the percentage of families that are offered a shelter or housing option In our system for unsheltered, that's almost 60%. A very high percentage of families are offered some type of option. Whereas for singles, only 18% of individuals move to a shelter option or housing option. So that there's big disparities that exist between individual subpopulations, and we can start to look at that. The biggest piece that I want to share is that by shifting our scenarios from moving to an annual point in time basis or annual person served and moving to this by name list, we would be able to be more responsive to what is actually happening in our community. And if there's additional refinements or changes that are needed, we'd be able to act more swiftly on that data based off of what's actually happening. So what's nice is that it goes from scenario development being a one-time big process, which then results in a lot of information from a technical assistance firm and then choosing a direction, to be able to have a more refined conversation of saying, how are we going to continue to address this problem? How are we going to cause a shift over time? So that is where the data is coming from for this project. I'm not going to be sharing the explicit data today. That's going to be coming in our future conversations. But I wanted to share the process, and I appreciate the opportunity to do so. The next part of our presentation is going to be by Sarah Murley, and I will pass the presentation over to her.
Thank you very much. Good afternoon. I'm Sarah Murley with Applied Economics. We have been assisting MAG on developing and costing these scenarios. We have actually worked for MAG for a long time, but primarily in socioeconomic modeling related to transportation planning. So using some of the scenario modeling type information to apply to this particular issue. Next slide, please. So in order to come up with costs for different scenarios, information that we need is unit costs on different kinds of intervention, looking both at one-time capital costs and at ongoing annual operating costs. And so looking at those things on a per unit basis so that we can scale those to different scenarios and providing assistance to different numbers of people in different categories. So in order to come up with these costs, our approach was to look at existing facilities and what their operating budgets were, and to gather information on capital costs for specific facilities, and ideally to have multiple comps in different categories so we could look at averages. The types of interventions that we looked at in terms of cost include traditional shelter, bridge and low barrier shelter, rapid rehab, and prevention and diversion programs. Next slide. So on the capital cost side, for traditional shelter, which not a lot of new traditional shelters under construction recently, but the city of Tempe had gone through an exercise to prepare a budget for traditional shelter construction. And so we were able to look at a cost per bed for that. On bridge housing, we had information from a number of different sources on purchase prices and number of beds for hotels that could be reused for bridge housing. And then for low barrier housing, our goal was to use local information to the greatest extent possible. But where we didn't have enough local information, we did use some information that from other areas. And so you'll see to California and Washington facilities for low barrier shelter. We're also still hoping to get some information on capital costs for low barrier shelter from community bridges. We have reached out to them for that. Next slide, please. So for operating costs, these are just the first two categories. On the next slide, I'll show you the other categories. But for an emergency shelter, and in most cases, we had some information for families and some information for individuals, because we are modeling families and individuals differently in the terms of the different scenarios. So I apologize on the first two sources for CAS and City of Tempe, those are both individuals. CAS is a little bit higher because those are services for vulnerable seniors. And so in any case, we were able to average the cost for individuals as a source for cost for families. Mix of individual and families on the bridge and low barrier housing. And also I will point out that this table contains information about duration that we're also using in the modeling. So in trying to understand the conversion from people to units or beds, that duration information becomes important. The next slide, please. So this is just a continuation on operating costs, looking at other kinds of interventions. We have been working with the Corporation for Supportive Housing, and they were able to provide information on prevention, rapid rehousing, and permanent supportive housing. And these budgets include staff, other operating costs, and rent, which I guess you could consider as another operating cost, but items. And averaged for the number of beds or units. And and these are monthly, so also obviously divided by 12. And this information from Corporation for Supportive Housing also included multiple programs that they averaged when they provided that information to us. So if there are, these are the costs that we're hoping to use at this time, but if there are additional facilities that fit into these categories that you are aware of, we would welcome the opportunity to add more data to this list in terms of additional comps that we could use to develop these average unit costs. So, you know, by all means, please let us know, or let Amy or Sapna know if there are additional facilities where we should seek budget information. Thank you. Oh, and I will turn it back to Sapna.
Thank you, Sarah, for the presentation. Can we go to the next slide, please? So I'm returning to the slide about the high-level scenarios that I mentioned earlier. These scenarios are for persons and households who are currently being assisted by the system. So they are in HMIS. In addition, as we all know, there are persons and households who might be facing evictions due to the pandemic. This is a different population than the persons who are, for example, living on the street or who are chronically homeless. The ones who might be facing evictions, many of them have not been in the homeless system. The vast majority have not been in the homeless system. And we don't want them to become homeless and to end up in the system. In addition, HUD really wants the funds coming from the relief funding to be used for rapid rehousing, for example, and for prevention, for example. So currently, we're examining research on surge modeling. So as the studies come out, we will update the board, and we'll let you know as we're collecting more data and as we're conducting more projections. When we present the findings, we will present them for information and discussion. Now, one of the policy questions when we're looking at scenarios, as well as on preventing persons who are not currently experiencing homelessness, to be preventing them from entering in the system through prevention and rapid rehousing, is a policy question is to consider, you know, what proportion of this population, of the persons who potentially will be facing homelessness, to assist as the eviction moratorium ends. As the implementation plan gets developed later this year, the allocation of dollars will also be made to respond to the highest priorities of the region, including more housing solution, more diversion, and more prevention. Next slide, please. So as I mentioned, for the next steps, we are looking to combine the projected housing solutions and with the cost that Sarah just presented. We would like to develop a range of cost projections that will inform the regional funding targets. As I mentioned earlier, we're looking for volunteers to meet and do a deeper dive with us of this analysis over the next 2 weeks. And so we'd like to vet the findings and the targets with the stakeholders. Finally, we'd like to present the findings on the regional costs and projection funding targets in June. One thing that I want to mention is that the cities will not be doing this alone. There is a range of funding that is available. And when it comes to providing assistance for persons who might have addiction issues or behavioral issues, access funding is also available. And now I would like to pass the mic on to Amy to conclude this presentation. Amy, the floor is yours.
Great. Thank you so much, Madam Chair, members of the board. I want to thank Sapna, Sarah, and Ty. They've been putting in significant time and expertise into all these efforts. If we can go on to the next slide, please. You'll see our contact information there. Please do feel free to reach out at any time. We encourage any questions or comments, any direction that you might have in this meeting, as well as after this meeting. So you have our email addresses, our phone numbers. Please do reach out and let us know if you have data that perhaps you can share with these efforts, if you have a perspective. We do want to make sure that we're building on your expertise. This is more sophisticated analysis than what we've been able to do in the past, primarily because of the expertise that you see on the team, being able to partner with you in this important work, and then because of the data that has been made available, particularly through TIE and through HMIS. So I want to thank all of our partners in this. We do consider you to be a close partner and look forward to any feedback that you might have on these efforts as they move forward. Thank you so much, Madam Chair. That concludes our presentation.
Thanks so much, Amy and Sapna, Ty, and Sarah. We appreciate that presentation. Again, so much work has gone into this, and I look forward to hearing comments from the board.
Madam Chair, I have something.
Yes, ma'am.
I just wanted to flag that on some of those slides, there was more of a national perspective for the averages as opposed to local. And I did see that like the average for rapid rehousing for families was under 2,000. But when I was the SSVF regional, the families system here was averaging more about 5,000 per family and had a much higher success rate and kept families in rapid rehousing a little longer so they could stabilize. And so I would just want to mention that we could probably have in our plan that for at least for rapid rehousing to increase that average amount per month per household.
Thank you very much, Madam Co-Chairs and members of the board. That's exactly the kind of feedback that we're looking for. If you have current local data sources, that is always our preference to plug into the model. And so the only time that we're benchmarking against national standards is when, for whatever reason, we don't have that local data. So if you can help us to connect with that, that would be fantastic. We'd be happy to be able to use that data then in our model to make sure that we're calibrating it to our current market. We used to be able to take our relatively affordable housing for granted, and that is no longer the case. The trend has been both in the rental market as well as the home ownership market. In the past 10 years, those prices have increased by 60%. And so it's important that we use data that is reflective of the market that we see here in this region. Thank you.
Bruce, I see you have your hand up.
Yes, thanks, Ryan. I just wanted to share with my fellow board members. There's so much activity going on now with MAG and with the regional collaborative and the city. Everyone's working so hard on this. This is the area that is the most interest to me. So probably Amy and Ty and Sapna are going like, oh no, why does he keep asking questions about this stuff? But I really have chosen this area to be my personal area of interest and kind of dig deep and sit in on some of the detailed discussions. And I got to tell you, I'm really impressed. First of all, I'm really a critic about numbers and projections because I've been doing them a long time and I see how badly I've done them on my own. But, you know, if we didn't have anything and we had 1,000 people and we just put them in 3 buckets and priced it out, that's easy. But we have an existing system, from my perspective, sorry, Amy, you know, that I believe is largely underfunded. So what is the real cost? What are the best cost numbers to use? And then we have people who we know something about, but we have to make assumptions. And what will people's flow through the system be? It's how we've talked about it. And it adds, when I explained this to the county manager, she said, oh, I kind of get that, right? So if you say, this is a rapid rehousing person, this is what it costs, let's just do it. Well, that's not where people start in our system. They often mostly start in shelters for some period of time, move on to something for some period of time, and then exit at some period of time. So that level of a sophisticated budget, rather than every unit being annualized at 12 months, that would be too much. So that level of sophistication is what people are working on now. And I also view this data as kind of an operational person, thinking like, well, if I had the money for this number of people, it's not going to happen July 1st. It's going to be, there's system capacity issues. So I think this work that we're doing is going to, the assumptions can be debated, but I think with those assumptions, it'll withstand significant scrutiny once it's out. And I think being cautious right now, because once these numbers are out, this is like the headline, you know, MAG says we need $10 billion to eliminate homelessness or something like that. So this is what a lot of people are going to be paying attention to. And I appreciate taking the time to make sure they're right before they're out. And it's not 10 billion. It's.
Thank you, Bruce.
Thanks, Bruce. Jackie?
Hi, really great work. This is amazing information that's coming out. I hope when we're looking at the disparities between families and individuals, we do remain mindful that a family is not one unit. There are multiple units in that family, multiple beds that we're talking about when we're looking at costs. And I don't want us to forget that and just continue to be mindful of that fact, that families are complex.
Thank you, Madam Chair, members of the board, and Ms. Taylor, absolutely agree. And in all of the analysis, we're looking very intently at a few different groups. And when we're looking at that flow and assessing the cost, we're being mindful of the needs of those different groups. So looking at people who are experiencing chronic homelessness as individuals, and then individuals who are experiencing homelessness but are not chronic, and then families. And so we're purposefully really holding families out as a separate category, because we understand that there are more people, and with more people, there is a higher level of complexity at times. Thank you.
Other comments from board members? I had one question myself, getting back to what Tamara was asking. Is there any, I mean, we have all of these types of interventions in our own community. I know we recently did a survey of what municipalities are spending on various things. Is there a reason that we can't get the data on our local programs?
Madam Chair and members of the board, I'll ask Sapna to jump in on that as well. I know that we're still collecting data. We haven't yet heard from, received final numbers from all communities yet. So that's part of the challenge. Another part of the challenge is how communities have defined the costs and track the costs is different. We haven't had a conversation necessarily about how to consistently do that. And so communities have, of course, defined it in the way that works for them, which is reasonable and appropriate. But when it comes to the regional level, then we haven't yet had that conversation about consistency. But something may have additional thoughts to say on that study as a lead.
Yeah, thanks, Amy. You're right. That's one of the issues, is that the definitions are not consistent across jurisdictions, and so it makes developing averages or comparisons harder, because the way one city has defined their expenditures is different. The other thing is, in many cases, in most cases, you have CAP programs. The cities make grants to service providers and nonprofits. And so that funding, there's a variety of sources that come in to provide the assistance, whether it is to individuals or whether it is to households and families. So as a result, what information we do have, which again needs to have some common definitions, and we saw this as an iterative process, something to improve on for next time, and in which case we will make sure that we are clearly defining it, and we'll work with the jurisdictions on the common definition. But what we have information on is the expenditures from the city side, whether that comes from CDBG programs or other programs. What we do not have is the expenditures made by the nonprofits who are providing the assistance or the in-kind. We have lists of in-kind in-kind services being provided, but again, getting a definition and a common understanding, a shared understanding of how to quantify those is to be done. It's not impossible to do. I think in the next iteration, we should be able to improve upon it, and working with the jurisdictions and working with the nonprofits and service providers, we should be able to reach a way to measure that. But for this year, we're limited by the information that we were able to collect, which was still incredibly useful.
Absolutely.
So
Thank
that
you.
was my question, I guess, was could we start work? I mean, if we're really going to cost out what it costs in our community and potentially apply this to municipalities or others, can we start working with, organization by organization? Could we maybe put definitions on things and start collecting information by intervention? And we don't necessarily have to broadcast by name what each agency spends per intervention, but if we could get those numbers and then average them, we have a really good local cost. So am I hearing you saying we don't have time to do that right now, or we just haven't gotten to that step yet?
Madam Chair and members of the board, we have presented the data in terms of the regional totals that have been collected so far. And so the information is available. If the board hasn't yet had a presentation on that, then we'd be happy to provide it. We have also reflected back to each community what their data has been. And so each community has their own data. In terms of the averages, we could calculate that. We do have some concerns about inconsistent data collection and definition, which would make averages perhaps a bit difficult to really understand and trust that we're talking about the same thing from one municipality to another. Sapna, do you have additional thoughts on that?
Yeah, no, I agree with what you just said, Amy. I think it's important that if we do calculate or if we get to the point of calculating averages, that we make sure that the definitions are shared, that there's a shared understanding. So the communities, when they're reporting, they have very clear indication of what numbers they're reporting. And currently, one thing that we learned through the process of doing the expenditure survey, which several members on this board were incredibly helpful in helping shape. So thank you for that. What we have learned, though, is as we started to get the results in and feedback, is that there isn't that shared understanding, and that will take some time to develop and to make sure that we get the buy-in from the jurisdictions who then will be providing that information. So currently, I would say for the next couple of months, we wouldn't be able to do that. It's something that we can consider, iterating on later in the year. Maybe it's part of maybe it's one element of the implementation plan or the action plan that the communities will engage in. And I think it's something to bring up again. And yes, we can present the numbers that we have so far at a later date.
Thank you, Sapna. And Madam Chair and members of the board, just to build on that a bit, I mean, in terms of how we can use the data, the utility of the data then is really giving a context to the implementation plan. And so if through these regional funding scenarios, we say maybe not $10 billion, but maybe it's some other figure, and then we can compare that against the amount that the region is currently investing. If it's double or triple, then we know, wow, we've got a lot of ground to cover in terms of our fundraising and in terms of bringing in additional partners. We know that the implementation of the strategies will cost more than what we're already investing in some cases, in many cases. And so being able to understand what is the current level of investment, regardless of which municipality is investing those funds, being able to compare that against the projected level of investment that will be needed to implement the strategies helps us to calibrate our fundraising as well as our approach. And so that data will be very useful right now as we enter the development of the implementation plan. In the future, it will continue to be even more important because we will be able to work with you to develop those shared definitions, the shared data collection methods, and then be able to coordinate that funding. One thing that I would like to point out in terms of those 14 strategies, and thank you very much for your support of them, the COVID coordination strategy has been, we're including COVID funding, but we're also looking to other funding sources because we know that we are absolutely going to need more than just the COVID relief funding that's coming into the region. We're going to need those ongoing funding sources that are available here in our region. Are you able to hear me okay? It seems like it's frozen a bit. Okay, great, thank you. You're either all sitting very still or my screen was frozen, so good to know that it's translating okay. So the data is important now for the implementation plan. It'll be important in the future, and we thank everyone who has been a part of that process. Thank you. Madam Chair, back to you.
All right, thanks so much, Amy and team. Again, thank you for this wonderful information. We will move on to the next item. Maricopa Regional Continuum of Care Board Mission, Vision, and Values. And I'd like to turn it over to Board Member Jackie Taylor, who will lead a presentation on our latest draft of the mission, vision, and values that we're recommending for approval.
Thank you, Madam Chair, members of the board. I'm really pleased to be able to present this work to you today. It's the culmination of literally months of crafting this final statement. We sought the input of multiple stakeholder groups. We were very intentional in getting feedback from people with lived experiences, and we consulted with our racial equity partners, consultants, Jeff Olivet and Donald Whitehead, as well, to be sure that we were incorporating our commitment to anti-racism. You know, at the end of the day, we really strived for definitions that were strong and powerful in their message, but also sought that balance that what we were putting out to our public was a product that even with the strength of it and the solidness of the statement, it could still be embraceable by as many people as possible. We wanted that ability to garner as many supporters in our region for the work of ending homelessness as possible. So let's start with our vision. Our vision is a region committed to anti-racism, free of discrimination, where all people have a safe place to call home. Our mission, the mission of the Maricopa Regional Continuum of Care, is to unite and ignite our communities to prevent and end homelessness. And our top 6 values: first, data-driven. We use quality data to make decisions and drive results. Second value, we are solutions-focused. We focus on solutions and deliver results with a sense of urgency. Third value, equitable outcomes. We provide individualized services to each person so each person can end their homelessness regardless of barriers. Inclusive, we cultivate an atmosphere of openness and incorporate people with lived experiences to share their knowledge, wisdom, and expertise. Nimble, we take risks and seize opportunities for innovation. And finally, excellence. We are fully committed and accountable to excellence. So I present this vision, mission, and values to you for your consideration today, and thank everyone literally throughout our continuum that lent their expertise to bringing these statements to fruition. Madam Chair.
Thank you so much, Jackie. Are there any questions or discussion from board members? As a reminder, please identify yourself before speaking.
This is Samantha. I just want to applaud everyone because I know this took a lot of effort to wordsmith. Like that is it's definitely a skill set. So I just am grateful for the time that you all put into pulling this together. I think it's awesome.
Thanks, Samantha. Anyone else?
Yeah, this is Liz. So just absolutely fantastic job. It's exciting to look at and then just energizes me for the work that we're going to be able to do. So you captured everything so well, and I just am very proud.
Thanks so much,
Hi,
Liz.
Sorry.
Go
Hey,
ahead.
it's Eric. I would just echo what everybody else is saying, and say I was not able to kind of follow through with this the last month or so. And upon revisiting and hearing Jackie read it, I'm with Liz. Like the enthusiasm and energy that's in the words is really powerful. So I'm thrilled that I think it can inspire us to carry forward with all the work we have to do. Thank you to everybody.
Yeah, this is Tad, and thank you, Jackie, too, and the rest of the team really for focusing on this. This is not easy work by any means, especially when you're working with a range of folks and different perspectives, but really appreciate seeing the pen to paper on this. And really, I think the first statement says it all, where health, equity, equality is front and center with the work that we have set out to do. And then of course, having that housing component that is our mission. So having that center, but also keeping equity at the forefront of our focus, I think is really critical. So I really think that was spot on, and really appreciate everyone's work as it relates to this. So. I can't wait to enthusiastically approve this. So, Madam Chair, when do we do it?
Anyone else? Because I'm about to call for that motion. All right, I think I'm going to do that. So can I get a motion to approve the new COC board mission, vision, and values? Please enthusiastically state your name.
Tad, and I make that motion.
Thank you, Tad. Can I get a second?
This is Joan Service. I second.
Thank you, Joan, and welcome. So we have a motion from Tad and a second from Joan. Now I'll ask Sarah to proceed with the roll call. Please be clear in your yay or nay.
Thank you. Co-Chair Ryan Balch.
Yay!
Eric Cole.
An enthusiastic yay.
Yes. Thank you, Eric. Elizabeth DaCosta.
Yay.
Thank you, Liz. Marshall Franklin.
Enthusiastically, yay.
Thank you, Marshall. Tad Gary.
Also enthusiastically, yay.
Thank you. Samantha Jackson.
A tough, like train to follow, and incredibly excited, yay.
Yes. Thank you, Sam. Bruce Liggett.
A ditto with all that, yay.
Thank you. Joan Service.
Hip, hip, hooray, yay.
I love that one. Thank you, Joan. Charles Sullivan.
Yay.
Thank you, Charles. Jackie Taylor.
Yippity doo dah, yay.
Thank you, Jackie. Co-Chair Tamara Wright.
Oh my gosh, this makes me so happy. An enthusiastic yay also. I'm so excited.
And the motion definitely passes. Thank you.
Hey, and a final woo woo. All right, that was exciting. So all of you out there, we spent a lot of time on that, so that's probably why we're all really excited. So, and I'm personally very pleased with the outcome. So thanks everyone for your energy and enthusiasm on that. All right, we are going to turn over to some updates. An update will be provided on legislative issues of interest, as well as Maricopa Regional Continuum of Care Subcommittee chairs and members will provide an update on recent activity. This item was requested as an ongoing agenda item by the COC board to remain informed about work taking place legislatively and from various subcommittees. So we're going to start with COC board member Joan Service, who's the executive director of the Arizona Housing Coalition, to provide a legislative update. Hi, Joan.
Hi, everybody. So about 30 minutes ago or so, the state legislative budget bills were dropped. We did have some advanced sneak peeks at what those budget bills were. And we're excited to report that one of the coalition's wish list priorities around enacting a state low-income housing tax credit is included in the budget proposal. It's a slightly revamped effort, allowing for $4 million every year, sunsetting after 4 years. So basically about $160 million state investment towards affordable housing. So that's exciting. Ultimately, as I mentioned, it's not as much as we had hoped, but we can do just like other states have done, which is get it out, prove its success, and go back to the state legislature for an increase. Our second policy wish list was around restoring the state housing trust fund. Because we believe because of the influx of federal funds, it was a kind of a big uphill ask to ask for that housing trust fund to be restored. However, and this is very important to note, however, we do, as housing and ending homelessness advocates, we know that we will be receiving a kind of a federal cliff at some point, and we'll start needing to make sure that housing trust fund is restored. So we do plan to advance that at next state legislative session. I will say that there are a few, and I'm trying to confirm, original budget documents versus what actually was introduced at the state legislature don't always make the weekend negotiations, but we had heard some initial rumblings of some federal funds to go towards Department of Economic Security of approximately $1 million for fiscal year 22 and 23 from federal funds to DES in the range of $1 million going to address homeless youth and families. And then in fiscal year 24, it would then revert to a state general fund impact, which again, we need to have, we're really strong proponents of making sure we have that strong state investment. Additionally, again, this is all kind of preliminary, so don't hold me to it. But we have heard some initial investment of about $5 million from federal CDBG funds in response to COVID to a West Valley senior shelter. So that would be a one-time allocation. So we're encouraged, we're excited. We'll see how the budget negotiations work out. Obviously, the clock is ticking. The per diem for state legislators has already decreased. So, and we know that a lot of legislators try and leave town for Memorial Day weekend. So we anticipate budget wrapping up by the end of this week, if not before. However, obviously a lot of the activities down at the state fairgrounds dictates a lot of stuff as well. It's a circus there too. So, so that's the kind of upfront news on the state legislative arena. I will share we're really excited about we're appreciative of the public service that I think we talked about this last time, but just in case we didn't, we're appreciative of the public service that former Director Ditmore provided to the state of Arizona in overseeing the housing department. But we're optimistic and encouraged by Director Tom Simplot taking the helm at the housing department. He very much agrees with some of our policy priorities and coordinating efforts around ending homelessness and affordable housing. So we will be look for, obviously he's going to be speaking. Well, maybe I'm going to hush my mouth because I don't know what he will be talking to everybody very soon. I think, obviously I'm really encouraged over the work that's going to happen between now and next session. Especially in getting not only a regional approach, but a statewide approach and engaging with state agencies. So I'm encouraged about that. And then I'm going to drop in the link. The Arizona Housing Coalition has asked to be a state, what do you call it? A state captain for Legislative Day with the National Alliance to End Homelessness. Typically, during the summertime, I'd be dragging you guys with me to meet with our members of Congress and some of the staff members. It's always so much fun storming, well, I can't even say storming the Capitol anymore. Visiting our members. I'm sad that we won't be with you guys in person, but I'm hoping you'll join us for a virtual visit with our members. So I'll drop that chat, the date of that, and look forward to your guys' involvement. Yep, and then obviously, thank you, members of the audience. We do have a new deputy director at the Department of Housing, Cindy Stotler. She is going to be assisting Director Simplot in overseeing, and we also have an existing strong executive team at the Department of Housing. So I'm really encouraged by the folks taking the helm over there.
Thanks so much, Joan. Questions from the board? All right, we appreciate that. Oh, was that somebody? Nope. Okay, we appreciate that so much, Joan. Thanks for keeping us informed. All right, next we're going to hear from Coordinated Entry Subcommittee Co-Chair Matthew Kelly, the lead housing liaison with Mercy Care. Matthew, are you on board today?
So Matthew sorry, Sarah. Madam Chair, Matthew could not attend today, so I will be reporting out for him. And he's on his way on the Bright Angel Trail in the Grand Canyon. So I'm kind of jealous,
cool.
But I'm happy to be here with you all. And I'll go over his notes, and I apologize if I miss anything, but I'm going to go do the best I can. So Coordinated Entry Racial Equity Work Group has started meeting. They will be reaching out to communities nationally to see what new processes or tools have been implemented to address racial equity. They will, Coordinated Entry Subcommittee will use this as a basis for evaluating what changes they'll want to make as a community. Following is a list of possible communities to be outreached: Tucson, Pima County, Pierce County, Houston, Orlando, and he has Minneapolis or Minnesota. Number two, the other thing that they are working on is the integration of the ESG CV prevention into Coordinated Entry. So all homeless prevention providers were identified, and a questionnaire was created and sent to get their input on current processes and prioritizations. All of the homeless prevention providers will be invited to participate in future meetings. Future meetings will be focused on reviewing feedback and creating a prioritization tool and the process for prevention providers. The Coordinated Entry Subgroup Committee membership. So the Coordinated Entry Subgroup membership has been reduced to 9. The capacity is 13, and they would like to establish a call for new members. It has been greater than a year since a call for new members, which is outlined in the timeline for the governance documents. There are a couple of factors that should be discussed and considered. The first one is, does the board want to adjust the makeup of the Coordinated Entry Subgroup Committee to include persons with lived experience and people of color, or was there another plan using the newly developed committee that would be used to meet this need? If you choose to add members to the Coordinated Entry Subgroup, it might require increasing the total number of members on the committee. The secondary thing was, is it possible to remove the requirement that a board member chair the Coordinated Entry Subcommittee? This has proven to be a tasking for board members. The third thing was, he's included the current membership of the Coordinated Entry Subgroup Committee and any missing representation. So the current membership is Tamara Wright with Community Solutions, Matthew Bress with the Human Services Campus, Randy Haid, UMOM, Ty Rosensteel with Solaris, Elizabeth DaCosta, CBI, Dana Martinez, A New Leaf, Mary Page, Maricopa County, Gerardo Pina, CPLC, and Matthew Kelly, Mercy Care. Missing representation are funder representative, CRRC representative, singles provider, youth provider, and ESG provider. So that's all I have from Matthew. Thank you.
Thanks, Nikki. Questions, comments from the board?
This is Melody Boyer from the VA. I would like to make a comment that the VA has requested for an invite to that subcommittee for approximately 9 months, and we have not yet gotten an invite to that meeting. We do have 2 individuals that'd be more than happy to represent the CRRC in that capacity, though.
So is that an
Staff, can you
invite
please
or
respond?
to apply? I apologize.
No, go ahead. I was asking staff if they could please respond, or even Tamara. You sit on that committee now, if you could shed some light.
Yeah, I sit on that committee, and we have it so it's open and public meeting, so anyone in the community at any time can join the meeting. As for a seat, I think that we've been trying to work on expanding what seats that we have in coordinated entry, and definitely wanted to have the CRRC included in that. We just haven't, we've been focused on the race equity pieces and haven't expanded that just yet. And plus we know that the board is working on how we want to have the committee structures set up, and until the board weighed in on that, we were just kind of holding off. But it's definitely an open and public meeting for all that want to attend.
Mm-hmm. Madam Chair, may I?
Yes, please.
Hi, thanks. I just wanted to offer the invitation that we would love to meet with you individually and talk over any concerns or any ideas that you might have, and really look forward to working with you very closely, and do encourage you always to be able to come to the meeting, and staff will make sure that you do receive that invitation. Thank you very much.
And may I add, my understanding is that VA staff did attend the last meeting. There were 2 VA staffs present. So if you're not getting that invite, Melody, please feel free to reach out to me, and my apologies.
Oh, I will do. I appreciate that clarification. Thank you.
I have a question for staff. So there were a number of things posed to us as a board during that presentation. Can you give me an idea of how we might go about addressing those questions? Is that something we would discuss and come up with a strategy for at the next meeting, or are there other ways to go about that, or trying to get an idea here?
I mean, I guess Matthew would like you guys, maybe some guidance from you all regarding his 3 questions, expanding membership, things like that.
Yes, so my question is, as a board, how do we have that discussion, and in order to provide that guidance that's being requested?
Madam Chair and members of the board, we are aware that all of you are very busy, and we want to respect your calendars. I know that we have about, I think, half an hour left in the scheduled meeting time for this meeting. You can absolutely discuss those questions that were presented today. If you would like to offer additional time to discuss those questions, as well as any additional data that you might want to have prepared for you, then we'd be happy to place it on a future agenda as well. But really, it's your prerogative, Madam Chair.
Okay.
Madam Chair.
Yeah, Jackie.
Doesn't this apply really across the board to other committees in terms of just general representation? So I'm wondering, that being the case, if we want to ask for some volunteers to serve as sort of a task force on this, to come back with an overarching recommendation to the board about just committee composition for all committees of the board.
Thanks for that suggestion, Jackie. Amy, is this more, is this specific to the coordinated entry subcommittee, or are all committees having a membership question?
Madam Chair and members of the board, the question posed was specific to that committee, but I believe that all groups are looking for guidance from the board in terms of who should they have serving with them, what is their goal, what is their purpose. I do believe that a conversation on that, it would be good to include the current leadership from each of those different groups, so we can talk with them about how they envision their membership perhaps expanding or changing, and then also having members of the board included in that discussion. So if the board would like, we could convene a meeting of a subset of the board members as well as the leadership from each of the groups to talk about what are the overall questions or trends or questions, ideas that they might have, and then how do we coordinate that among all of the groups so we have an equitable system in place and structure that really serves the board, particularly as you pivot to those policy issues that are really just reaching a critical decision point right now.
So I'm seeing a lot of head nodding. Yes, we think that would be a good idea. I also just caution that I do think that each of the subcommittees are unique and might have their own different things that they want to, address with the board or get some guidance from the board. So I guess if left to my own devices, please don't leave me to those. But as a suggestion, we would defer to staff to set up a meeting or maybe multiple meetings and start from there.
Mm-hmm.
Absolutely. I wonder, sorry, it's Eric. I wonder, yeah, I think it all makes sense. I think there's a discussion from the board standpoint of we've done great, incredible work with our vision and our mission and our values and the bylaws. I think we probably need to look at this from a board standpoint at the same, and maybe we could do those things at the same time. Depends on we'd have to do two sequences probably, but I've been in a few conversations about these kind of things over the years. So I think I'm volunteering.
I think you're right that our next piece after mission, vision, values was to dive in more to the charter and the structure. But I would love to, so I'd like to continue on now that we've enthusiastically approved the first piece. I'd like to continue on with that, but also maybe we could incorporate, this sounds like a good time to incorporate actual feedback from those committees, and maybe we can hear from them one by one or all together as we move forward in that process.
Madam Chair, Mr. Cole, and members of the board, you're exactly right. There are at least two different elements to this. One is having the committees help identify what do they see as their value add to your process. And then there's a discussion among the board members, what do you need from the committees and from the various groups, and what direction do you want to offer to them? And so I think being able to have both conversations, and Madam Chair, I agree, that might be one meeting to get a sense for what are the universal or the common trends among all of the different groups, but then keeping care and attention focused on the nuances that are present within each of those groups and their specific needs as well as opportunities.
Other comments? All right, hearing none, if staff would make that so, I would be grateful. Thank you so much.
Thank you.
Okay, and thanks, Nikki, for that, for filling in for Matthew. We're going to move on to the data subcommittee, co-chair Jeremy Huntoon, senior manager with Community Bridges. Hey, Jeremy.
Hello, I'm Jeremy with Community Bridges, co-chair of the data subcommittee. So to provide an update, we most recently have received a data request from the VA requesting weekly reports. So we went ahead and made the recommendation to move forward to the COC board's consent agenda for them to review that. This is client level data that will be provided weekly to help the VA in maintaining an accurate by name list. We've also more recently heard a presentation from Linda Jensen with the Arizona Housing Coalition on a statewide database warehouse. So this is to identify if and how people are moving throughout the state, and also to help and drive that statewide advocacy. And then that's just a very brief overview on some of the work that we've been doing recently. That's all I got today.
Thanks, Jeremy. Good to see you.
Good to see you.
Any comments, questions from the board?
Hi, this is Melody again. Just forgive my ignorance here, but your format's very different than what I'm used to. So as I understand it, that was approved under the consent agenda. Is that correct? That data item request?
Yeah, so that will be moving forward and coming in front of the COC board.
Okay, thank you.
Okay, any other comments from the board? All right, thanks again, Jeremy. Moving on, I'd like to invite Rachel Milne, Assistant Director of Housing and Community Development with Maricopa County, to provide an update on the Emergency Solutions Grant Subcommittee. Hi, Rachel.
Hey there, thanks for having me. Just so everyone knows, the ESG Subcommittee is made up of all of the government entities that receive ESG funding in the community, and that is Maricopa County, DES, Phoenix, Mesa, Glendale, and most recently Tempe. Prior to the coronavirus pandemic, we met quarterly, but with the huge influx in ESG CARES Act funds over the last year, we've actually been meeting bi-weekly. So a huge thanks to Julie Montoya for helping make that happen. We've been meeting a lot really to make sure that we're coordinating with each other. We know who's RFPing for what at any given time. There's been multiple application processes, so just really wanted to make sure we were coordinating with one another. And then our two main focuses of late is we are working with our HUD funded technical assistance provider to help us be prepared not only as ESG grantees to be monitored by HUD for all of this CV funding, and then also to monitor our subrecipients in a coordinated way. So helping to get some monitoring documents prepared for when we're ready to go out to monitor any of our CV grantees, and also be prepared when HUD comes to see us. And then most recently, we hosted a rapid rehousing listening session for all of the ESG rapid rehousing providers. We had a big listening session back on May 14th to hear kind of what's working, what's not working with all of the different ESG contractors, and trying in an effort to try and get us sort of along the same page. Each municipality has different contractual obligations for these rapid rehousing providers. So it's we're trying to correct where we can. So that's our big focus moving forward as well.
Thanks, Rachel. That's so good to hear. I know one of the things I think about a lot is the difference in our rapid rehousing programs and how each funder, you know, the criteria each funder puts on it. So it's neat to hear that maybe you guys are working towards, or at least talking about it, and maybe working towards something more consistent, or just getting a better picture of what's happening in our community.
That's the goal. Yeah.
Yeah, appreciate that a lot. Any other comments, questions from the board? Really appreciate you leading that work, Rachel. All right, and last but certainly not least, I'd like to invite board member Samantha Jackson, Senior Director of Strategy and Community Affairs at Downtown Phoenix Partnership, to give us an update on the Racial Equity Action Planning Team.
Awesome. Thank you guys. You've already heard a lot of really good information as it involves this, but just as a reminder, the action plan has 4 priorities. That's changes inside the coordinated entry system, modifications in data and how we use it, capitalizing on lived experience and growth in workforce with diversity targets in mind. Nikki was awesome in her kind of review of everything coordinated entry. So I will leave it at that. The data group meets monthly, and members have been looking at trends within their own organization's data collection. A toolkit is being considered that each organization can use to guide monitoring their own collected data, especially as it relates to HMIS. In lived experience, they've been flourishing. Just to hear Sarah Kent speak about it is really inspirational in a way. So they meet now, and also an advisory council has been formed, and they meet on the 2nd and 4th Friday of every month at 10 a.m. And anyone who has lived experience or interest in this council is welcome to reach out to Sarah Kent and get involved. Her email address is skent@azmag.gov. And then the workforce committee, we had our first meeting this morning, and we are looking for more minds and hands to join this committee. We'll be focusing on developing a shared values statement, looking at diversity targets within leadership and involvement in all of the different kind of work areas of the continuum of care in our organizations. And then we really want to dive into training, especially as that relates to elected officials. And that's all I got.
Awesome, Sam. Thanks so much. Board, comments, questions? No, Eric?
I'm sorry, I've got a quick one. It's Eric. Sam, are y'all looking for members from the board or from elsewhere on the workforce committee?
All of the above.
Or both?
Both.
Okay, I will volunteer. I'm also on the county workforce board, so if there's a way I can help with that, I've told the board a couple times about our updates and whatnot. If I can help with that, I'm happy to too.
Thank you, Eric. That's awesome. Anyone else? All right, hearing none, thanks so much, everybody who gave an update. Really appreciate you being here and keeping us informed. It's great to get that live perspective of all the work you guys are doing all the time and keeping that present. We really appreciate that. Next, wanting to see if any board members have any actions or discussion items for future meetings. All right, if you can't think of any today and you have some in the future, please reach out to myself or any member of the MAD team. Probably Sarah would be best. Yep, she's raising her hand. Appreciate that. And then finally, comments from the board. For this next agenda item, comments from the board. Is there anyone on the board that has any other announcements or events they would like to highlight today? Go, Bruce, but unmute yourself.
Thank you, Ryan. Rarely do people say that. Just a couple quick updates. The Maricopa Board of Supervisors has preliminarily approved an increase in our homeless funding by $5 million, $1 million in ongoing general fund, and $4 million in one-time general fund to be used this year as part of our overall mix of all the different fund sources we have. Second, the board gave guidance to us in terms of the funding under the American Rescue Plan Act. So the board has approved, the county's getting about $800 million. First half of it is here already. The next half is coming a year from now. The Human Services Department's going to get about $127 million dollars of that to allocate. So 40 million in housing, 12 million in homeless, and 20 million in eviction related activities, in addition to senior workforce and domestic violence. So a lot of work now being done to flesh out the specifics of how those will be done. And each will have probably a variety of methods, including internal staffing, amendments to existing RFPs or contracts, possibly IGAs and RFPs, which I think the bulk will be RFPs. So as things are posted, I'll let people know.
Super exciting, Bruce. I mean, whoever thought we would be talking about these amounts of money in our lifetime?
Exactly.
It's incredible. So thank you for that update. Anyone else? Arshel, did you have something?
Oh, no, I'm sorry. I was trying to take myself and put myself back on video and unmuted. No, I'm good.
Okay. No worries. Okay. Well, hearing none, that is all for us today. Thanks everyone for being here. It was lovely to see all of your faces. Tamara, please come back to us real soon. We don't want to miss you for very long. And thanks everyone. Meeting is adjourned.
Thank you, Ryan.